So here we are back 2024,
Yeah,
cancer-free canine. And so, yes, and Randy, normally we do these canine victory stories where I interview everybody on their cancer wins and their process. And you were part of Dr. Judy Morgan's cancer victory story process.
oh, okay.
So then I actually got to meet you in person, which was super fun.
Yeah,
And you met my dog, who's a bulldog in a china shop. You met the little monster.
I did indeed.
Yeah. Don't tell anybody how awful he is. And
Oh, I don't think he's awful at all. I mean, dogs, I like them when they're active and rambunctious. That's why you have them, I think. They're like kids, you know?
he is totally like psycho. He's 6. He's a English bulldog and he's 6, and everybody thinks he's still a puppy, which is because of the holistic approach.
Yeah,
And and
I like
I always ask Dr. Jill to test him. I'm like, can you just do the VDI lab tests on him? She's like, oh, he's pretty healthy. Don't worry about it. But all of us are seeing this whole outbreak of issues in canine health, and they're ticking time bombs. Like, dogs don't always let us know that they don't feel great. They're like, there might be tiny, tiny, tiny clues, but to do some diagnostics that we never had available to us in years prior, why not get a snapshot?
yeah.
So you guys, this is Randy of VDI Labs. He is actually the creator. He has been in the human space for years, has over 20 human and animal patents in intellectual health properties. You have created these specific tests now to help us see inside our animals' bodies. And so, Randy, thank you for being here today.
Well, it's always a pleasure. I enjoy getting out, talking to people, particularly pet parents. I'm a pet parent myself, so I'm on both sides of that equation. So I understand kind of what people go through. You mentioned diagnostics, and the fact that comparing to human to veterinary, they really don't have that breadth of them, although it's getting a lot better. But that's kind of really what drove me to come from the human to the veterinary side, was the fact that I saw so many on the human side, and there wasn't like anything on the veterinary side other than a CBC and a chem, which are, I mean, I see sick dogs that have normal CBCs and chems, I mean, so what good are they sometimes?
Well, and I've seen very, very sick dogs with clean microbiome, animal biome tests. My own sister died of melanoma, and the next day the labs called us and said, good news, Melissa's blood work's perfect. I'm like, she died. Like, she
Yeah,
died yesterday. And so the average blood work that you get at your vet just fails us.
it does. Yeah, well, I mean, that's kind of what drove me into the field of cancer, to be quite specific. I mean, I've been on the human side, as you indicated, at Quest Diagnostics, and probably many of the viewers here know who Quest Diagnostics is. It's a big reference laboratory in the United States, anyway. And I was in the esoteric division, vice president of that division, and we did a lot of specialty tests there, which really aren't in there. And what got me drawn into cancer was, well, my sister died of cancer. I mean, and then she had a pap smear that wasn't really done properly. And then she ended up getting cervical cancer. And by the time they got it, it was already late stage. She went through treatment regimens of it, but, died after diagnosis 9 months later. And it's like, wow, I mean, they need to catch this stuff earlier, because you catch cancer late. It's kind of like, what's the point? And then my dad died of cancer. So sadly, cancer runs in my family. And that's kind of, yeah, I mean, I think it's like a lot of families, I mean, and I think cancer is driven like, yeah, kind of in our environment. I mean, my God, I mean, microplastics, nanoplastics are running all over the place now. It's a problem. And so what do we do about it? And I'm pretty passionate about I have a Great Dane, and she's 2. This is my second Great Dane. Danes, as you know, don't live particularly long. And so I want to make certain things are right, and we do a good job for all these pets.
Randy, was your previous Great Dane your inspiration to roll into the pet field? Like you have so many years in the human field. What triggered you to be like, oh, I want to do pet testing now?
Well, the dearth of markers in there. You know, our first one was a cardiac marker, which we ended up selling off to IDEX, which is doing very well. Then we ventured into cancer. Yeah, I would say, you know, I had a really bad experience with the whole veterinary care scenario, and this was, you know, highly paid specialists and everything like that. You know, the dog had GI disorders. You know, I think in retrospect, it was just simple inflammatory bowel disease. But they wanted to go in and do invasive exploratory surgeries, biopsies, everything. And yeah, it came back as inflammatory bowel disease, but the dog never made it back out of the exploratory surgery.
Oh,
I mean, what's the point?
oh my gosh, that's horrible.
So I said at that point, you know, I said, you know, we're going to try to do the best job we can for non-invasive diagnosis. You know, I mean, sometimes you have to, and I'm not saying you don't. So don't get anybody misreading what I'm saying. I see sometimes you have to, but if you can without it, then that's what you need to do. Particularly GI disease. You know, GI disease is pretty complex. We've got a pretty big GI offering now. You know, you mentioned microbiome. Now we're into that, and so it's really helpful to try to bring all this together for fast, accurate diagnosis early. That's what we need.
Yes, early detection, like that little snapshot. So how often should people be testing? You have an assortment of tests, like to click on your website and do all the drop downs. I'm like, where do you even start?
Yeah,
Like,
I know.
Randy, what do you recommend here?
It is a bit overwhelming. I mean, we do a
It's
lot. I mean, we
it's
do a lot.
awesome too, and it's global. Like you are not just limited to the United States. You were telling me the other day that your tests are going out to all over the world.
Yeah, you know, you know, it's kind of a little side shoot on this whole topic is that, you know, when we started doing this, we're doing like every reference lab does. We use, you know, FedEx or, you know, UPS or whatever to overnight specimens because they're not stable, right? Specimens are biological, they're not stable. You know, cold packs, whatever. You know, just like we're having now with the winters, or hot summers or whatever the case may be. These specimens sometimes are delayed, labor strikes, who knows what reason, hurricanes. And I was paying a fortune in FedEx bills, and I said, we got to fix this. And so, you know, I invented a dry technology. It stops time. It works fantastically. We get samples now from Korea, Australia. We just are opening up a distributor now in Brazil, Sao Paulo. We're about ready to open up into Germany and the UK. It all comes to California, by the way. It all comes to California. And that's what's cool.
That is cool, and I'm fortunate to have you in California.
Yeah, it was great to see you at Dr. Jill's. I mean,
I know.
wow, it's a small world, man. My sister lives right there. So it's nice because I can go see my sister, I can see Dr. Jill, I can see you. It's really nice.
Absolutely. It is fun, isn't it?
Yeah.
So blessed. So where do you start with the panel? Like you have a glyphosate panel, you have a hair testing, hair heavy metal type panel, you have GI panels, you have a vitamin D panel, you have a whole cancer screening. Like, help us.
Okay. Well, why don't I share some slides? I mean, I got way too many for this conversation, but I will find some select ones that maybe people might be interested in.
Wonderful. Anything that's going to help pet parents know what to do and get that snapshot of health and wellness and not be sidetracked or just sideswiped with like my pet was totally healthy.
So I can't see this as well as you can. You should see a dog on a chair, and is that fine?
It looks good. You just need to push present.
Okay. If I do that, can I do it without presenting present? Because otherwise I'm gonna have to bounce around on slides. It'll probably drive people crazy.
Okay.
Is it fine?
Yeah, you're groovy.
Okay. So you asked about menu, and I'll just go ahead. You know, we do offer a lot of things, and on this slide is kind of the breadth of things that we offer. We offer on the wellness front one that I think we're probably the largest vitamin D testing facility there is, and if anybody hasn't tested their pet or themselves for vitamin D, man, you need to be doing that. Vitamin D is about disease prevention. So easy to fix, and many people are vitamin D low.
As
Unlike
well as dogs, Randy. Like, how many dogs do you see that are low? How many tests that come in your data?
I'd say probably more than 75% are low, particularly if they're on a commercial diet. Obviously, ones that are on, better holistic kinds of diets, they tend to do better. But it drops with age. I mean, as we get older, I got their gray hair. You don't absorb things as great. And dogs don't get it from the sunlight. I mean, I don't know if people know that or not, but dogs and cats, they only eat it. It comes from the protein source. So if they're not eating well, no vitamin D.
And what about B12? How is that really important?
B12 is very important, and B12 is important because it is makes all of your DNA and amino acids. There's a whole B12 folate cycle that's important. It also it's a dietary thing. It comes on in, and it can be just like vitamin D. It can be low, and if it's low, you're going to have problems. That's why so many times you go into the supplement store and you'll see super B complex super vitamins and stuff like that. I mean, so if it's a need for us, it's probably going to be a need for these pets, and so that is the case. Then and magnesium, I'm just going to highlight that one on these essentials, is that magnesium shouldn't be discarded. A lot of times people don't think about it. Magnesium is needed for all the enzymatic functions, the cofactor. We got interested in it because a lot of times magnesium low patients are vitamin D low patients because there's a reason for that. But if your viewers type in magnesium deficiency and insulin resistance and type 2 diabetes, they'll see that it is actually a risk factor now in humans. That's how important this is.
I've heard that most humans are deficient in magnesium. So I believe probably our dogs are too.
Yes, they are. So something for us to keep in mind in. I'll be quick on this slide, and then we can go into whatever you'd like to go in. Basically, we have inflammatory markers. We're probably going to certainly talk about cancer screening. We have a marker for the early detection of osteoarthritis, pretty important for dogs. We have fur testing, which is great for mineral, environmental, and toxic elements like lead and mercury. We have an
Randy,
allergy panel.
do you do human mineral testing too?
No, we are dedicated to just animals.
Okay, too bad.
Yeah. We have a suite of cancer offerings listed on this page, and then a lot of GI related things. So we can tell you whether the patient has GI cancer, IBD, pancreatitis, and so on. So where would you like to start?
Whatever you think. If you're a dog owner, so you know how you feel about your dog, what would you advise any pet owner that wants a healthy, happy pet to live forever?
Well, I would say the first place to start is vitamin D. I mean, when we started this company, it was like when I was at Quest, that was like I was part of the whole vitamin D launch thing. So it became huge on the human side. And I said, it's got to be important on the veterinary side. And so we launched a number of veterinary supportive publications with universities. And this was one that we supported for Tufts. And you can see that 75% were insufficient because pet food just doesn't often provide it. If you take a look at this slide, you can see that these are all different brands. I just highlighted a few of them. Not supporting any particular brand. What I am recommending is more of the fact that it's the protein source. So this one from Origin had to do more with wild salmon versus a chicken in a hen coop. They're not getting sunlight. And so that's the problem. If it's not in the food, it's not coming into the pet. And herbivores make it
Absolutely.
by the sun. Omnivores like us do both, and carnivores make it by food. That's kind of how
Well,
it
and
is.
vitamin D is a little sketchy because if you get too much, you get death. And if you do too little, you get chronic illness. So you have to test.
Yes, you do. I've been asked the question of can we just start supplementing vitamin D without testing, and I advise against it.
It's like Russian roulette.
It is. It's not an expensive test. We'll give you the dose, exactly how much to give. It works really well. We test like thousands and thousands of dogs and cats, horses too, and alpacas. We all share vitamin D, by the way. Isn't that
Awesome.
something? You got to think about that for a second. If all these species share the exact same vitamin D, man, it must be important.
Amen.
Yeah.
I didn't know you tested alpacas.
Yeah, we'll test
That's
anything.
cool.
But I think the key is, if I may just go to one slide here, and then we can move on to another topic, is the veterinary literature is showing that there is a lot of diseases that are increased when you have deficiencies in vitamin D. And cancer is certainly one of them, but it's not just limited to cancer. Since vitamin D is involved in the innate immune process, anything that might alter the immunity of the patient. There's an interesting fact. There was a study done recently with COVID patients. We just got out of the pandemic. Yeah, I don't know. Did you get COVID?
Twice.
Yeah,
Yeah.
twice. All right.
So I was taking, oh, I probably can't say it online. I was taking a warmer and I never got it. And then I went off that warmer and then I got it. And then I had immunity for 6 months and I kind of timed it. I was like, well, let's see how long this builds
Yeah.
immunity. And 6 months later, I got it again. I was like, darn it.
Yeah.
But
Well.
yeah.
Well, I've gotten it too. I think a lot of us have gotten it. The only comment I was going to make on it is that they did a study looking at vitamin D sufficiency in humans that had poor outcomes with COVID, and vast majority of them were very low. You die of not the virus, you die of the response to the virus, the inflammatory response. That's what you die of. So vitamin D helps regulate that, and that's why it's important. Yeah.
Yeah.
So
Awesome. And interesting about the kidney disease. I didn't know that, Randy. I didn't know about, I'm not savvy with cats. So to see the cat mortality rate, I had no idea.
yeah, it also affects kidney disease. It affects just about everything. I mean, I won't get into the biochemical pathways because I've probably pretty much hit the snooze button on everybody. But trust me on this one. It's important, and I take it. I don't know if you take it, but
I totally take it.
all
Yeah.
right.
I haven't tested my dog in a while. How often should we test? I was testing every 6 months, but it's probably been like a year since my last test.
Well, annually is okay. So that's fine. Annual is a good time. And then if it's low, then you supplement and check within a couple months after that to make certain it's okay. And if it's okay, then you just keep going again annually.
Right on.
Yeah, so good job. So I guess the next thing that I guess probably would be I would kind of go through our stuff that I would recommend is in the area of maybe cancer screening. It's probably, since that was the topic of this particular talk, we probably should talk about it.
Yes,
Um,
absolutely.
yeah. I think everybody's pretty much familiar with the statistics, and if they're not, I'll repeat them. And that is more than half the dogs over the age of 10 will develop cancer. And certainly high-risk breeds are more predisposed. I think there's another statistic that says about a third of the dogs over 5 will develop cancer. I think that's the other statistic that's thrown out. And I read something, maybe you read the same thing, is that the incidence of cancer is increasing in animals, and the incidence in humans is increasing over the age of 50. I just recently read that. So not a great statistic.
Right. And with all our new information, with all the new facts and awareness, it's not changing.
No, I mean, I think it's the environment, it's the stress, it's the food. You mentioned glyphosate. I mean, that's certainly glyphosate is certainly a factor, particularly in GI disease. Oh, did you know that glyphosate and celiac disease are highly correlated? If
Oh,
anybody has celiac disease, I mean, there's like a 1-to-1 correlation between the two.
I'm
So
not surprised, but I didn't know it was a 1-to-1 correlation.
yeah, it's pretty strong. So it is it's everywhere. I was doing some reading when we came up the test. I always have to be really knowledgeable about whatever it is we're doing. Um, so I did a deep dive into glyphosate, and it is it is everywhere. I mean, it's in our food, it's in our water, it's in our air.
In our breast milk.
Yes. And
Absolutely.
fun fact. I think if anybody ever uses Roundup, they say like it's ineffective. It has a limited effectiveness. You can spray it and then it's like goes away within so many days or something like that. That's why it's safe, right? Well, here's a fun fact. When we started doing stability studies on glyphosate in urine, which is a hostile environment, by the way, it is good like for almost forever. You don't have to refrigerate it, you don't have to freeze it, you don't have to do anything. You can just let it sit there in the urine and it doesn't go away. I mean,
That's shocking.
it's
Well, and
scary.
Monsanto Bayer has paid out to human cancer cases. Like the court has awarded people for their issues causing certain types of cancer. And I think they're more like blood and lymph type cancers. So you actually offer a test. What is the general data on that test? What are you seeing? Like, I'm super curious to see how high the glyphosate or
Well,
glyphosate.
glyphosate can get quite high in dogs. I mean, I haven't tested, we don't do human testing, but on dogs, it's very high. Particularly if they're on like commercial food. It just depends on it really depends on how it's sourced, to be honest with you. I also know it's a big problem in horses. A big problem in horses.
Most all of alfalfa, at least in California, is sprayed with alfalfa. Alfalfa seeds are soaked in Roundup, so Roundup ready seeds, and then they actually spray the crop on top of that. And then so you also wonder about all the farm animals that we end up feeding to our dogs and cats that are in feedlots if they're eating all that glyphosate, so a second generation exposure.
Right, right. So yeah, it's a big deal. It's certainly, it causes leaky gut. I think that's a term people understand. Yes? Yeah.
Yes.
Um, Leaky gut is a real thing. It is a problem. What happens is you have these tight junctures that open up, and when things open up, things get through. That can be allergies, by the way, right? Because everything's passing through your body, right? Lots of food and everything like that. But the body doesn't see it all. But next thing you know, you got these leaky gut, these junctions that are opening up. Certain allergens are now exposing themselves to the body that they wouldn't normally see. And next thing you know, the body makes antibodies against the allergen. And then you end up with inflammation. And that inflammation then is in your gut, it's on your skin, it's a problem. And so we're
Well,
working on some leaky gut tests. That's another thing that we're actually working on right now to help identify patients that do have leaky gut.
I think
Um,
that's really awesome. And I think people get confused because when we say autoimmune, it's actually an overactive immune system.
that's right.
And so you can have a suppressed immune system or an overactive immune system, and then you have all this sepsis going on from the leaky gut. So it can get a little complicated and confusing.
It can, and it can be a little overwhelming. I mean, I think to your point is that the immune system has to be regulated. You can be immunosuppressed or you can be hyperactive. I mean, vitamin D helps. It's not, it's not a magic, silver bullet or anything like that, but it definitely helps in regulation of it. I mean, I've seen atopic derm patients. I talk to veterinarians all the time, and it's very common in these atopic derm patients that are like deficient in vitamin D, and then all they do is fix the vitamin D, and next thing you know, the patient's doing much better.
I had no idea. Thank you
Yeah.
for sharing that.
Yes. Yeah. I mean, so I mean, we see all types of patients because we're specialty, so we see a lot of crazy cases. And so I talk to vets, all the time, and so we get this exposure, which is really great. But anyway, getting a little bit back to cancer screening. I would imagine that's pretty important to people. I mean, we just talked about the high incidence of cancer, all the reasons potentially why. So we did develop a cancer screening test, which we recommend for dogs and cats. It's useful for both, although I think most people tend to be focused on their dogs in this regard more so than cats. And what we do is we test it with these markers here, and I'll be very, I won't get too esoteric about it. But we use a marker called thymidine kinase type 1. It's a DNA proliferation marker. We call it TK1, but it's abnormal DNA proliferation. So when the cell grows abnormally, it upregulates this particular pathway, which is what we measure in the blood, and that's how we detect this abnormal growth. So it's a true proliferation marker, which makes it great for the early detection of diseases. It also makes it great for monitoring, which is another topic, but monitoring the curation or the remission of patients being treated. A lot, oncologists use it for that, veterinarians use it for that. And then we couple it with a inflammatory marker. So this is canine CRP or feline haptoglobin. Most people probably are familiar with CRP, right? Because there's a human version of CRP. We happen to test for the canine version of it. And this is the major acute phase protein that's made by the liver. And why do we do that? Well, cancer is an inflammatory disease. So we bring these two markers together in a multi-marker approach, which is more powerful than a single marker. And that's how we're able then to have, very good sensitivity and specificity. And so this next slide, which is really the last slide I'll discuss on this one point, and that is that we did a clinical study with University of Missouri, and it was a specific study focused on screening. Now, a lot of companies do studies, but it's really important that you do a study that's focused on screening. And what does a screening study mean? It means that you have to actually take apparently healthy animals, and then you have to follow them over time. You test them at time 0. You don't know if they have cancer or not. And then you follow them over time, and you see which ones develop cancer. And then you associate that with your markers. And then you can say, oh, did I do good or did I do bad? And so we had a good sized study, 360 dogs. And we followed them for 6 months to a year. And we found out that we had an 82% detection rate, which is really quite good, which means that the dogs that were looking happy, wagging their tails, eating, otherwise, right? I think you mentioned at the start of this, like a lot of times you don't know because dogs are, they hide their signs, right? I mean,
yeah, I really think people don't understand how sneaky dogs are. Like, I don't think they always want you to know that they don't feel awesome.
Yeah.
I think they don't want to put that burden on the pet owner sometimes.
Well, I think it might be the fact that they're a pack animal, and if they start showing any kind of, whatever that shows, that's a sign of a weakness, right? And you don't want to be weak in a pack, and you are their pack, right? I mean, the family is the pack. And so, but you are the alpha, right? I mean, you are the master of the pack. And so I think it just their natural thing. It's like, my daughter, she has GI problems, and like this morning, I took her to school, but she was like complaining and stuff, okay, we'll have to deal with that. But I go down and talk to my dog, guess what? She's not talking to me, right? She's not saying anything. But sometimes she doesn't want to eat.
Here's the study that you guys did, 82% detection, 360 dogs deemed healthy.
Yes, it worked well.
That's crazy. That's scary, actually. I mean, good for you, but scary for the pet owner, right? Because
Well, yes and no. So, I mean, I think there's two schools of thought on this, and I'll just share both schools. I mean, one is the I don't want to know school, right? I don't want to know because cancer is a death sentence, and I can't do anything about it. And so, why do I want to know? And leave it at that, right? And the other school of thought is, well, cancer is really not a death sentence. There's a lot of things that you can do about it now these days, and particularly if you catch it early. I think that's the key, right? I mean, I think when most people think about cancer, it's always when you catch it late that is like, well, the death sentence. But when you catch it early, well, I can't tell you how many times we've had very successful outcomes from the detection of the cancer early. I mean, let's run down the list. I mean, you have mast cell tumors where you can cut them out. You've got an anal sac adenocarcinoma before it becomes lymphoma. You can deal with that. You've got a splenic mass, hemangiosarcoma, which is really deadly. But if you catch it early, you can do splenectomy, take it out, and then you're fine. So there's a lot of good examples of early interaction or intervention to have positive outcomes. And I think that's really the story that I subscribe to. But I mean, we have a test for it. So it really just depends on what people want to know or not know.
right. And I've had a lot of talks with a lot of people and pet owners that even though the tumor's gone, the cause of the tumor may not be. So you really have to like deconstruct what you're exposing your pet, yourself, or however that got to manifest.
That's right.
So yeah, so I don't want people to be deceived. I have had a lot of clients be like, oh, they had cancer in the past, but they took it out and my dog's fine now. I'm like, no, cancer's an expression. The tumor's the expression. We have to like be proactive for the rest of your pet's life.
So we have another test that I think might be very interesting to people in the wellness category, and that's in the area of osteoarthritis. And then we can get on to maybe some other topics. But this one is really for the early detection of degenerative joint disease. And we have a blood test that actually measures synovial fluid, the component of synovial fluid. And it is elevated when you have a leaky capsule, which is what degenerative joint disease is, or osteoarthritis, or IVDD, which is for the spinal cord. But regardless, we can detect it early, and it really works out nicely. And there are a lot of things you can do to slow progression, whether it be oral hyaluron, Adequan, other things that can be done to help slow progression. So I think that's another key one that I would highly recommend in the wellness space that to keep your animal healthy and active, because if they're not moving around, they're not particularly active, are they?
Stagnation is not healthy. Absolutely.
Right.
Anything stagnant goes south.
Right.
Yeah. I didn't know you could, I didn't realize hyaluronic acid is like the detector for that. That's so
Yeah, I
fascinating.
mean, yeah, it is. I mean, so I think what do people know hyaluronic acid for?
Beauty,
Yeah, there you
actually,
go.
it's beauty products,
Yeah.
but
And why is it in a beauty product?
because it's anti-aging,
Well,
it's anti-inflammatory,
yes, and what else does it do?
it heals.
Yeah, but it also helps remove wrinkles too, right?
Oh, absolutely. I used to like slap that stuff on my face. And then they I still do when I can find it, but they used to sell it in LA by the bottle for a drinking, supplement, and I would put it on my face actually.
Yeah.
And then they caught on to that and pulled it off the market.
Yeah. Well, anyway, my point though is the reason why it's in cosmetics is because it is hyaluronic acid, or hyaluron absorbs a lot of water. It's called hydrophilic, philic meaning love, right? It loves water. And so it just sucks water in, and then it becomes big. It's a big molecule. And so what it does is it acts like shock absorbers for your car inside your joint. That's exactly what it does. right? And it lubricates. It's really like slippery, right? I mean, if you ever put on it on there, it's like really slippery, right? Yeah,
Yeah, it's
right. Well, that's
awesome.
that's
I
how it works
missed
in your
it.
joint. Yeah, that's how
Yeah.
it works. And so you need the gear oil in your joint. So that's like the
Yeah,
Tin Man.
and
You got to get that
interesting,
oil can.
I never even thought about the name, like the fluid in vehicles that are, you know where I'm going with this, like the automatic vehicles that have the, like you push a button and they go up, and that's called
Oh, that's no, that's you're talking about
hydraulic
hydraulic fluid.
fluid,
Yeah,
but they're kind of a similar name of hyaluronic and hydraulic,
yeah, I
so
guess so. Yeah.
it's the canine version of hydraulic.
Well, it's like they can move, right? But it really
Absolutely.
works well, and we have a test for it, and we can. It's a major component of synovial fluid, so we measure it, and it's a very good test. Something that I highly recommend for large breed dogs, older dogs, even cats. Cats can get osteoarthritis, and the thing about cats versus dogs, cats live a long time, right? I mean, much longer than a dog, typically.
Right. Typically.
So, yeah,
And what
although
about horses, Randy? Side note on that. Can
uh,
we test our horses for this?
you could. We're not. I mean, the answer is yes, you could. It's not something that we have fully validated yet in the equine field. The most of the tests that we're doing in equine right now are related to cancer with the TK test. We can detect equine lymphoma, so that is a test that we run.
Wow.
Uh, so this is one that we're still having to work to validate to see what's important is not just to have a test, but also have data to support the test and its application so veterinarians know what to do with it.
Excellent. That's exciting. There's a lot more cancer in horses these days. We used to never see it.
Oh, is that right?
Yeah.
Hmm.
Yeah.
Maybe it has something to do with the feed.
Yeah, I'm sure it does. You should probably combine that lymphoma test with the glyphosate test on
Yeah,
horses.
probably should. Well, I'll keep that under advisement.
Thank you. I'll be the first.
All right.
All right. What's next?
Well, then I would say we have a lot of different cancer tests, and I'll just go to this one slide here, and that is wait, not this one here. Hang on, what is it?
So are these for detection or tracking the cancer?
These are for I can't find that one slide. Anyway, these are for so we have early detection of cancer, and then we have diagnostics. So that means different types of cancer. And so what we want to do is be able to detect that cancer early. And we have one that's specific for GI lymphoma. So we have the way our menu works is that we have cancer specific for the task. So if you've got lymphoma, we have a panel for that. If you've got a solid tumor like a splenic mass, we have a panel for that. If you've got a GI disorder, which is what I think I'll probably talk about because I think that's probably most relevant to people, is we have a panel for that. And we came up first with this GI lymphoma panel, which is a multi-marker panel that combines not only TK1 and haptoglobin and CRP, but it also encompasses other markers to allow us to detect GI cancer very early and effectively. I mean, this is the one that I was really motivated by my dog. I wanted to have something that could distinguish between inflammatory bowel disease and intestinal lymphoma. And so this is kind of what drove the genesis of this. And it took us, a lot of time and effort to do it. But then we came up with a panel that actually was able to do it. And
So Randy, if we have a dog with chronic bowel issues, should we run this if it's not resolvable?
yes, you should. But actually, what I would recommend is going to our advanced GI panel because while IBD and lymphoma are certainly major things, there can be pancreatitis, there can be protein-losing enteropathy, there can be vitamin D issues with or malabsorption, there can be small intestinal bacterial overgrowth. I mean, a pretty long list. So to deal with that, we developed a a really big panel using the power of computers and pattern recognition. And this one is, I think, is really quite powerful. And it allows us to look at a lot of different things simultaneously, so we're able then to distinguish between these various types of cancers or GI issues very rapidly. So we highly recommend this one. It's called the Advanced GI Panel. So if any client or excuse me, any pet parent is interested or has a vomiting, abdominal pain, diarrhea, any kind of GI related matters, this is the panel to run to, because it'll help your veterinarian determine what the heck's going on, so they can actually determine what the right treatment is.
Excellent. Now, people are asking, there's Gabby from Mexico, who's a veterinarian, and somebody from New Zealand also asked, are all these tests available globally?
Yes. So everything is in our dry technology, and I can quickly show people what I mean by that. This slide right here demonstrates why we are global. So we developed this. This is a patented technology that we have in this little black device. You put serum on it, a component of blood, and it gets packaged up in here, and it can then be mailed to us. And we get samples from Korea, samples from Australia, all over the place. So if you're in New Zealand, you said New Zealand?
Yes.
Yeah, I mean, they just have to establish an account with us. We have one in Tokyo, for example, and then they just ship it to us. And it's very easy to ship because it stops time. So I think this slide kind of distinguishes everything that we're talking about here. It dries the sample. There's no refrigeration required, and it has up to 2 weeks stability. And so if you're trying to, if you send it to us, you don't have to worry about, if there's a delay a little bit with DHL or FedEx or whatever method that you're trying to internationally ship to us with. And
And I
so,
love that you have a turnaround time of 7 days.
well, the turnaround time is all dependent upon the speed that you get to us. So we test every day. So when it gets to us, you get the answers the next day. So it's just a question of how fast it gets to us. For most people in the United States, if they're sending it to us, what we call by snail mail, right? They just drop it. Literally, it's like a little love. I always say, "Oh my God, we got so many love letters today," because they look like little love letters. It takes on average about 7 days. But if you send it to us by FedEx, we can do it like the next day, right? So there's just depends on how you want to send it to us. But you have the option. And that's the beauty behind VDI. You have the option. And so internationally, that's the only way you can send us stuff. And that's why we have partners in Brazil and all these various markets, because we're able to give them the logistics that's cost effective, stable, and then everything's done here in California.
Now, if we don't have a veterinarian, I'm lucky enough to have one down the street, but what about all the people whose vets don't carry this?
Not a problem. There's two ways. They can either, they can contact us for what veterinarians may be in their area, or the other option, which might be a little easier, is they can go to VDIdirect.com. That's Victor David India Direct.com. All right, so VDIdirect.com. And if you go to VDIdirect.com, almost all of our services are available for purchase in these like test kits, kind of similar to what you're seeing here on the screen. You get the collection kit. Very similar to like although different sample type, like 23andMe, right? You get a little kit in the mail, right? And then you just got to get a sample and you send it back to us and we test. Now, in this case, we need blood. So they're going to need to get a blood draw. So that's the only, it's not saliva, you need a blood draw. So here, what you would need to do is go to a neighborhood vet, get the animal drawn, apply it to the kit, and mail it to us.
Excellent. And so if we're coaching, like Bronwyn's on this live, and she coaches a lot of cancer people, not people, dogs, sorry about that. So for her to be a cancer canine concierge and helping all these animals, how would she use this? Like as to detect how her protocol's working?
Yeah, so if she is looking to see how her protocols are actually functioning in terms of cancer therapy or other types of therapy, you would just then follow it appropriately. We have like getting a little bit more esoteric here, but we have the ability, like this is an example. On our test requisition form, all the medications are listed, which can be holistic or traditional. And then we look for trending. And because all medication, whether it's holistic or traditional, what do they actually do? They curtail the inflammatory response, they curtail the abnormal growth or proliferation. And since we have a proliferation marker and an inflammation marker, we're able then to see the net effect of that trending down. And so this happens to be the GI lymphoma panel, monitoring GI lymphoma, looking at all these markers right here. And then we can see that, oh, they're trending down, they're all green, they're all positive. So treatment was effective. And we can confer that back to the practitioner.
Excellent. That's so insightful.
It is. And there's another slide here for like more traditional cancers. That would be like, I'll show 3 slides. This is for like a lymphoma or hemangiosarcoma, something like that. You know, the red is the black is TK1, the red is the inflammatory marker like CRP or haptoglobin, and the goal is just to get below the dotted line. So this is something we do. This is a service we provide. We actually graph these things out for you, and when you test and you start treating, you should see these things drop and be below the dotted line, and that means treatment is effective versus treatment ineffective is they don't go below the dotted line. And so it works out really, really effective. And that's why we highly recommend monitoring, monthly monitoring, by the way, 4 to 6 weeks is a proper time interval to do this in order to actually know how well the treatment is actually working.
That's so cool. Bronwyn, do you want to ask him anything? Her dog's
Oh,
mauling her right now.
yeah, I see that.
As always. As always. And people are asking if there's going to be a replay. You guys, this video will live in this Facebook group. I'll also load it to my YouTube channel. It will be posted in the guide section. So in the guide section, I have every single interview we've ever done on this page, and you guys can just scroll through it. Eventually, I hope to turn this all into a podcast. So, yeah.
So I did have one question,
Yes.
and you'll have to forgive me. I was in the middle of a consultation and I was trying to hurry up and get over here after that was finished. And then I have another one at 4. So I walked into the middle of the conversation about magnesium. Would you be able to explain what you were talking about? Are you saying that cancer dogs are also deficient in magnesium?
Oh, yeah, like I would say a lot of dogs are deficient.
Really? Okay.
A lot. Yeah, and I mean, I wouldn't just limit it to cancer. I mean, certainly cancer is a yes,
Well,
but a lot are. And we have a blood test for that, like a serum test, and then we have a fur test. And I would recommend the fur test because it actually is a more it's a so when you think about your blood is under endocrine control. I mean, like, think about glucose for example, right? I mean, your body works really hard to keep glucose normal, right? Your body works really hard to keep calcium normal, and your body will work really hard to keep magnesium normal. But that's not where it's stored. There's less than 1% of calcium, magnesium, and all these other elements inside your blood. Most of it is actually either in your bones or your intracellular. And so we decided, hey, you know, why don't we try to find a better metric for it? And that's when we said, you know, fur would be really good because it's coming from the cell itself. The hair is representative of whatever that moment in time is. And so it's not under endocrine control. So the hormones are not affecting this. And the real cool part about this is that it's like a 3-month average, because that's how long about hair and most pets last. It's about 3 months. And so it's like an average of a 3-month window of time versus a single point in time like blood is. And then what we measure are all 29 elements. We have all these different dietary minerals like magnesium, manganese, cobalt, calcium, copper. These are all important things. Then we've got environmental ones like aluminum. That helps if you want to know that the dog's chewing on a aluminum can behind the garage and you don't know it.
Or just some of those cruddy stainless steel are actually aluminum
They are.
bowls. A lot of people don't realize that.
They don't. I
And
can't tell
Randy,
you.
what about selenium? I hear that's, low selenium can be a contributing factor
It
also.
can be, yes, low selenium can be a contributor factor. So all these things are actually quite important. And then what we do is we tell you what the value is, and then we try to tell you how to fix it. We actually have protocols. Well, I don't have a slide for this, but attached to the report itself would be supplements that would be appropriate for whatever the problem is, and dosing, by the way. And we even have a protocol for the heavy metals like lead and mercury. We have we work with a company that actually makes a very nice chelating product that actually removes it from the body. So these are all things that you can. I like this test because it's a nice average snapshot that gives you a good insight of what the animal is eating and doing. And I like that.
That's so exciting. We just had Dr. Katie Woodley on my membership talking about this. Does she use your test?
I don't know. I couldn't. I maybe. I'm not sure.
Okay, because we were really impressed. Like, just everyone was jaw dropped over this, and I've never done this before. I've had clients do it, and I love the fact that you guys actually analyze the test, because we've looked at tests before and gone like, how do you even interpret this?
Yeah. So we try to do all that work for you, and allow you to fix the problem when it's incurred, and that might be supplements, or may even be a complete dietary change. And this is something you would discuss with your veterinarian or nutritionist, what the best mechanism is. That part we don't do, but we do at least provide the data to initiate that discussion if there should be a dietary change.
And Randy, I think it's important for people to realize that toxicities and deficiencies are equally as important. Like, I believe the pet holistic industry really focuses on toxicities, and we don't talk enough about possible deficiencies. I don't know.
Yeah, I mean, I was a little surprised at that as well. Being, I guess, relatively new to the pet diagnostic arena, I thought it would be more readily understood, and it wasn't. And so, I mean, we were the company that did the landmark study that defined vitamin D deficiency, insufficiency, and sufficiency, right? And it was like, well, what does that mean? I mean, well, that's on the human side for like forever, I mean, so yeah, so we did that, and the same applies with B12, the same applies with magnesium, and so you'll see that on our report. So I think it's really quite important that these things are paid attention to and then corrected, because there's no point doing a test and getting an answer if you don't take the trouble to correct the problem.
Right. And when do you retest after, let's say we all do this and we get our results back and we implement it? Do we retest in like 3 to 6 months or a year?
Yeah, we tell you that. It's usually anywhere from 2 to 4 months. Like vitamin D is 2 months. B12, I think, is 4 months. Magnesium is like about 4 months as well. And the reason being is that there's an equilibrium period that it takes time to do that.
And how do you do that glyphosate test?
That's done through mass spectrometry. So the same as with fur mineral analysis. So it's actually run through a mass spec, if anybody knows what that is, that then looks at all these things simultaneously. It's actually quite magical if you think about it.
That's awesome. And so is that fur or blood? That sounds like fur then.
We can do both. We recommend fur because blood again is a point in time, and blood again is back to this whole concept of being under control. Doesn't mean you can't do it. Now with glyphosate, either way can be fine. In fact, glyphosate, it could be done either blood, fur, or urine.
Yeah.
Three environments for glyphosate, and it really just depends on what answer you want. Most of the time, I think people are looking for more of a time average versus an acute event, and so that means that it's not a single point in time you want; it's more a longer window of time, and that's usually then fur is a little bit better for that.
Great. Thank you for clarifying that. I always wondered about that is when I see people's blood work and it says calcium on it, and also you guys have a calcemia test, a hyper and or just a calcemia test. And you guys, I don't know if you understand that some cancers build calcium in the blood, and that's actually how the pets die, is they suffocate from too much calcium in the blood.
Yeah.
So in human oncology, they measure the calcium and you go hypercalcemia as you're getting closer to death. And so people don't talk about that in the dog space. So Randy, should we, like, if we have a dog that is suffering or treating in active treatment, do we run that calcemia test?
Yeah, you should. I mean, it's a little bit more skilled to interpret the results because it gets into the endocrine system. If I have some slides on that, I do. So we have a calcemia panel, both for cats and dogs. We have a unique, what you're measuring, one of the key components of this is you're measuring the parathyroid hormone coming, right out here, and it helps control all of this. And we can tell you what you're talking about. This is getting very esoteric, but then this is cancer down here. I mean, so this is calcium versus PTH. And so what happens is you got hypercalcemia, it gets into this high level, as you just mentioned. PTH drops because it no longer has control because the cancer's got control. And that's why it's in that lower red box right there, is because it lost control. But we can distinguish between, for example, hypercalcemia due to cancer versus hypercalcemia due to an endocrine disorder, in which case PTH would be very high, and that would be that one box up there. And so we graph this out, and then it can be very useful to determine what is the reason for it and how bad is it.
Wow, I didn't know you could do that. That's super cool.
Yes.
Amazing, Randy. Anything else you want to share with us? I know you have to go soon.
Yeah, I would just say that in general, I think if I could give some advice to people, I think early detection is better for everything, even if it isn't gives you some heart palpitations. I mean, it may not be great, but the news is going to be coming to you sooner or later, and I recommend sooner, particularly if you want your animal to live a long and happy life. You'd want the same for your child, and you'd want the same for your loved pet. So I highly recommend, running, whether it's our diagnostics or others. I think blood diagnostics in the pet space is increasing tremendously in response to the need. That's why it's increasing tremendously. And I do believe that that's something that people should try to take advantage of and help to determine what's going on with their pet.
I always say you'll either pay on the front end as prevention or pay on the back end as reparative.
Yes,
So
absolutely. I agree.
choose your payment in that regard. So I'd rather do prevention for sure. Prevention is the best medicine.
It is. I think that it is something that I think people are more and more becoming cognizant of, and I think the new word though is sort of like disease prevention, disease intervention early on, and not just are we just looking for how do we prevent them from happening in the first place.
My dog is barking. Sorry, you guys. Somebody drove up. But yes, thank you, Randy. And I just really learned so much today.
All right. Well, my pleasure. Anytime you'd like to talk about something, I'm always happy to talk.
Excellent. Well, I look forward to testing my dog. I've been badgering Dr. Jill for a while. So you guys, when I test my dog, I'll share the results right here on this platform.
Very good.
Hopefully it's not bad news. Oh my gosh. Oh my goodness. Thank you, Randy.
All
Have
right,
a
my
great
pleasure.
day.
Thank you.
Bye.
All right. Bye-bye.